Welcome to Healing the Tigress, a podcast of conversations and stories on Asian American Pacific Islander maternal mental health. We are your hosts. I'm Peggy, a perinatal mental health therapist.
And I'm Jasmine, a clinical pharmacist who is perinatal mental health certified. Both of us are Taiwanese American mothers who have lived experiences of postpartum depression and anxiety. It felt like we didn't see anyone who looked like us also struggling with their mental health in new motherhood. But we would go on to learn that it wasn't just us and that there was so much more to perinatal mental health.
So we created this podcast because we know that sharing these stories can begin to break the stigma of mental health in our community, and we want to help heal the inner tigress in all AAPI parents. Let's get started.
Welcome back, listeners. Today's guest will be talking about the topic of Hyperemesis Gravidarum, or HG for short, which is a severe form of nausea and vomiting in pregnancy that requires medical intervention. In 2012, Kate Middleton brought a lot more public awareness to HG, which helped to begin to destigmatize this condition, empower other mothers to seek help for it, and not dismiss it as just a minor pregnancy symptom. Our guest today is also a survivor of Hyperemesis Gravidarum, whose story also seeks to help other mothers destigmatize not only this condition, but perinatal mental health as well. Please help us welcome Raag Malhotra, a perinatal mental health psychologist, therapist, who transformed her own journey through postpartum depression and HG across 2 pregnancies into a mission to support mothers that are navigating their darkest moments.
As a mother of 2 and a specialist in postpartum depression, anxiety, and rage, she brings both clinical expertise and lived experience to her work with South Asian mothers who face unique cultural pressures around mental health treatment. Through her platform at Mom's Inner Journey on Instagram and her dual market practice serving clients in India and the US diaspora community, Raag creates a bridge between evidence-based care and the raw, authentic reality of maternal mental health struggles in South Asian families. Thank you for being with us here today, Raag. Would you please give our listeners some context of your cultural background, as well as where you are in your motherhood journey?
First of all, I want to say thank you to both of you for having me. It really means a lot. And about me culturally, I'm basically from India, the southern part of India, and I moved to the Bay Area 3 years back. And I am a mom of 2 kids before being a therapist and a coach. So I have a 5-year-old and a 9-month-old. And my first pregnancy was in India during COVID, and my second pregnancy was here in the US.
Wow. So you have kind of a bridge between 2 worlds, and you can kind of see how mental health is across the board in both places.
Yes.
Yeah. Thank you so much for being on our show and being willing to share. Many people are familiar with nausea and vomiting as symptoms during pregnancy, but Hyperemesis Gravidarum, or HG, is not as well understood. So can you tell our listeners what your understanding of HG was before you became pregnant, and then how it changed as you were physically going through pregnancy and experience it for yourself?
So my each pregnancy was in different countries. So in both the context, I'm just going to give a bit about it. So I heard about HG through celebrities.
Like Kate Middleton?
Yes. So I was like, okay, this is something, fancy thing which they go through. There's a treatment and they get through. And that is how I knew that there is something like HG which exists. And then when I got pregnant in India, it was quite bad. It's like you are just throwing up a couple of times a day and you are dehydrated. And those ginger tablets, crackers, nothing worked. And you can't even put the water down. So you have to go to the hospital. So back in India, I had to go to the hospital. I was hospitalized every month, for 4 days because I was losing a lot of weight. Now, the interesting part is They are telling that, oh, you are feeling anxious because it is COVID. You're just overthinking because, the condition of the world is like this and you have no idea how to navigate. So I was like, okay, maybe it's possible. It is possible because COVID, you feel anxious, you don't know what's going to happen next. And the interesting part is my file already said that I am Raag Malhotra, I am 30 years old, and she has a condition called Hyperemesis Gravidarum. But there is like total, the medical condition is written on your file, but there is no acknowledgement in reality. And there was no psychoeducation. Everything went to that, you're just overthinking. That's why you're ending up in the hospital again and again. Fine. Second pregnancy was here and the US, and I thought this time I will not have it. The sickness is not going to be that bad as compared to the first one. I was pregnant. Oh my God. It was a roller coaster. It was worse. And it was worse than the first time, I remember. And, being in a new country, understanding the culture, the healthcare system, because they are really poles apart how India's healthcare system works and how in the US. And I ended up going to the ER. And when it was my first time going to the ER, I had no experience before it. And every time in the ER, you see so many patients going through more, you feel more severe thing, accidents are happening there next to you. I went there and they said, oh, it's very common. And I was like, wait, I previously have a history of HG. And I don't know if it makes sense now. So I was like, does it, I'm just mentioning because I had a condition before. So just to keep you updated, this is my Indian file and it says I had HG. So they are like, you had 50% chances of getting the second time. Weren't you informed? I was like, oh my God, we are back to square one. And when we moved here, I was pregnant. I didn't get any appointment with my OBGYN for the whole first trimester. And I felt very helpless. It was like, what am I supposed to do? And in the ER, things are quite fast. They are caring, compassionate, but things are quite fast. So during my first trimester, I think I went to the ER 7 to 8 times.
And this was before you even saw an OB?
My first trimester, I couldn't see my OBGYN. There was no appointment available. And I was like, it really felt that, oh my God, this pregnancy, I don't know how I'm going to survive. Every time is like how I'm gonna survive. And yes, the ER was very supportive. Like now they knew my face. They knew what to do.
So she's back.
She's back
ER
again.
was your OB. Oh my
Yeah.
gosh.
And but finally, I think in my last visit, I met a really good doctor there in the ER, and she was like, when do you have your appointment? So I said, this date. And she was like, let me contact the hospital that you have to meet your OBGYN once you're out from here. She has to, find a time for you, which was very helpful. And then I got my appointment with my OBGYN. And I'm really very grateful to my doctor that time because when I sat on the chair, the first thing she said, I'm really sorry, Rag, you had to go through this. That acknowledgement, I just getting goosebumps when I'm telling this. When she said that I'm sorry you had to go through so much, it really comforted me. I really wanted to be seen and heard that time that more than physically, it was mentally exhausting. And she said that I had no idea you had a previous history, else I would have kept everything in the plan. And it must have been so hard for you these 3 months. And I was like, wow, these are like golden words I just wanted to hear because I was dismissed in my last pregnancy that this is nothing. You're just overthinking. You're anxious. You're anxious. That's why you're throwing up. But this time, she acknowledged that it's a medical condition. 3% of the world population goes through it. So you are under that 3%. And it is tough. And she was very honest with me like, your 9 months are going to be a roller coaster. So we have to come up with a plan with the doses of, Zofran or whatever oral medication which is going to work. It was a hit and trial method, to be honest. Sometimes the dosage works, it doesn't work. So after a month, things were back into place. There was medication ordered. This is when I am supposed to take because whenever I used to go in the car, also the motion sickness also used to trigger. So it was like I used to avoid, stepping out from the house also, that I don't want to throw up again. And that fear that if I eat something, I'm going to throw it up. If I drink this simple, like an orange juice, also, I'm going to throw up. So I was sitting with a lot of anxiety, and my OBGYN validated that these fears and this anxiety is obvious because it is very traumatic what you're going through. And so we had our IV fluids orders in place, and my hospital, they used to check in with me every month. Like, your orders are placed by a doctor. If you need IV, just let us know, 3, 4 hours prior so that we can keep a space for you. And that was a huge, huge blessing, I would say. And after that, yes, with that so much isolation, because in pregnancy, you think, the second time, especially, I thought this time I'm going to celebrate. Earlier, it was COVID, and with the health not supporting at all, I didn't do my baby shower or, the gender reveal, nothing. And the second time, I had the expectation I can do it, but it didn't happen again because I didn't have the energy to do anything. And, any kind of smell of the food used to trigger the nausea. So I was like, I don't want to risk myself putting into this. Yes, medication, IV fluids, everything, but it takes a toll mental health wise, to be honest. And my OB/GYN saw that I am stepping into depression because of it. I am feeling anxious because of it. Because, whenever you see any birthing person outside, you see that, oh, they are so healthy. They are so active. They are doing, whatever they want to do. And I used to sit with this question, why not me? Why can't I enjoy my pregnancy? Why it has to be so hard? Everyone says like, okay, the postpartum is going to be hard, but the pregnancy can be hard as well. And these traumatic events, it does not just goes away. It stays in your body. And with my both the pregnancies, I still remember once I gave birth, I was exhausted. The thing is, the nausea stops, vomiting stops, but you carry that trauma in your body that, oh my God, you were throwing up throughout the pregnancy. You are not being seen. Everyone is like, oh, you have morning sickness. It's going to be fine in 12 weeks. 12 weeks till 38 weeks, you're throwing up. So it's just so traumatic. And I was like, it should not be dismissed. I think no mom should be dismissed saying that, oh, you are overreacting to the morning sickness. It's a medical condition, and yes, with a proper treatment plan physically and mentally, it does wonders.
I feel like your story is even beyond the sphere of OBGYN, that just historically medical professionals tend to minimize what women go through in general.
Yes,
Even going back in history of like, it's hysteria or it's this, oh, you're just being anxious.
yes,
I don't know how many times I've heard someone tell me that a provider told them that they're just being anxious. It's so minimizing when you had a condition that is potentially life threatening, from my
yes.
understanding as well.
Hmm.
Yeah. And it sounds like your mental health began to struggle. And I'm curious about what kind of help you sought during that time when you mentioned that your OB was considering that maybe you had depression.
Yeah, so I had a past history with my first pregnancy with postpartum depression and anxiety. She knew about it. And with my first thing, it got diagnosed 2 years later, post delivery. And when I told her everything with the history and everything, she was like, let's take a pause. Within the department, they had a reproductive psychiatrist. And she was like, you should, try to take an appointment with her. She's like, she didn't push me. She's like, these are the options available, choose it, go through it once and see if it's, you're able to relate to it, if it's going to help you. And I did book an appointment this same day, and it was very helpful. And, the acknowledgement by the OBGYN, the psychiatrist, and the therapist made lot of wonders for me, because every time I had this fear, now this person is going to dismiss. In the whole family dynamics, also, it's like, it's just morning sickness. All the moms go through. You are not an exceptional case. But I was like, I am an exceptional case. I come in that 2% category. So you don't know what I'm going through. So I was like, yeah, I am a unique, exceptional mom. The fear doesn't go away. I would be honest about it. But you learned the next time how to navigate it.
It does sound like you're saying is like that trauma that sort of lingers with you. Like you had it the first time already as it was, and maybe the first time you didn't understand it as well because there was that whole dismissal and throwing in of, oh, it's just pandemic anxiety, right? And so maybe you weren't as clear, but the second time around, it was like, no, no, this is a thing. I am experiencing it again, and I will not be dismissed this time. But so this is the pregnancy period, is you're already suffering so much of this mental anxiety and trauma, reliving it over and over and not knowing what to expect. But then I guess, experiencing HG does set up the stage for even postpartum mental health challenges. Now, what was the period of postpartum like for you? What did you do to get support then?
So, when I was in my third trimester, my doctor, like the OBGYN and the psychiatrist, came up with a plan. They were like, as soon as you deliver, you might feel exhausted. So, within 2 to 3 days of my baby blues period, they were like, how do you feel? I'm like, I am exhausted. And I was like, I have never felt so tired in my life. And I'm not telling physically, but mentally, I feel exhausted. And I was like, I can't hear the sound of someone throwing up. I still have that fear that what if I throw up again? Like, and trust me, 2 3 months of my postpartum also, I had nausea and I was taking Zofran. So it is not that once you deliver the baby, you are like all happy and joyful. No, I had it for 2 3 months postpartum, and I was taking Zofran during that period. So it is like it doesn't end. You carry it with you, and that grief that why my body has to go through it. Sometimes I do sit with that question with myself and in therapy as well. And I have come in terms that your healing journey is not linear. And I don't want to dismiss what I'm feeling, to be honest. Like what I went through my pregnancy and my postpartum, that trauma, that because to be honest, SG is a kind of trauma and it has PTSD symptoms. So I was like, this time I'm not going to dismiss. I'm going to sit with that sadness and grieve that it is okay. Like what I wanted and what I got, it's totally poles apart, but that is okay. And I would really tell like all the moms, like treatment options are available, that they should take help. And if the healthcare system, the OBGYN or, any doctor you meet dismisses you, that is your calling that you need to dismiss this doctor and see someone else. That you don't have to suffer alone. And I was suffering and alone. It is very isolating because where I live, there were so many moms who were pregnant during the very same time. And everyone is like, oh, let's go for a walk, let's meet up. And I was like, I can't even get up from my bed. So please, suffering alone, it is not a sign of strength. It takes a toll. And talk to your OBGYNs openly that I have this condition, nothing is working. Don't give me this ginger tablets or crackers option or keep sipping, water in between. Nothing is working. So you have to take that step to ask. And the thing is, during that time, through the Her Foundation, which does a lot of, awareness regarding SG, so they had posted something on Instagram, and I commented, "Oh, this is me. I went through this." And when I saw that page, it was wonder. So they have these support groups which they run. They run their peer consultations, like people who went through it. And through that, I met many moms who were going through it. But the thing is that they were all in the US, in the UK, but I couldn't find any South Asian mom speaking about it. And to be honest, I have till now not met a mom who's a South Asian said that I had energy. They're like, we had morning sickness, but it is okay. I am like, I had morning sickness, I had SG, but I'm not okay with it. Yeah,
Maybe after this episode comes out, some South Asian mom's going to reach out to you and be like, I had HG too.
I really hope so because the more the stories are out, the more you feel that I am not the only one who suffered through this. You need that community. You need that, to be honest, that validation that I am not the only one who's suffering. And why not talk about through stories? I think it does wonders. That's why I started talking about it on my Instagram page. And it clicked through so many moms. Like, this was my journey. This is how I was dismissed. So I think the stories should go on. It shouldn't stop.
Can you tell me again what the name was that organization was that you found the support groups?
Her foundation. Yeah, it's in the UK.
Yeah, we'll try to link some of those resources afterwards in the show notes so people can check that out if they want more.
And there is one more, HG Canada, and they do the advocacy.
Yeah, I think it's just not as well known about it that people can say, oh, that's just normal pregnancy symptoms. But when it gets that severe that you need to go to the hospital for hydration all the time,
Yes,
that's not normal.
that's not normal at all. Because see, till 12 weeks, normally all the doctors says that, it's going to settle down. But it doesn't settle down throughout your pregnancy. Every month, every trimester, every day, you are like, when will this stop? When will I stop, throwing up? And there is, to be, first of all, you're physically going through so much. And mentally, you have this thing that, oh my God, you already feel anxious. What if you lose the baby? What, because of my condition, I'm going to harm the baby? Because you can't eat, you're not able to put down water, and you're just losing weight every day. What if it happens again?
How did you end up slowly starting to gain weight though? Was it just all through IV hydration and nutrition?
Yes. So it was actually, I started gaining weight in my end of the second trimester. And there were regular checkups with my OBGYN to check, the heartbeat of the baby, the movement of the baby, because I wasn't gaining weight. I was taking the IV drips to keep myself hydrated, but my intake, like a normal person, was not there. And there were very few things I was able to eat protein based, like just a yogurt and just, eating yogurt every day for lunch, breakfast, dinner. You can't eat like a proper meal. So you feel anxious that because you're not able to take proper nutritious meal, what is going to affect the baby? And this is something that's not under my control. So I told my OBGYN that I need to see you every 2 weeks. And she was okay with it. It is not like every trimester once or during, the scans we're gonna meet. But I was like, let's meet every 2 weeks to check in. Maybe not physically. We just sit and chat with each other. And she was like, absolutely, yes. She was like, we were gonna sit and talk. And usually the physical checkup happens in 10-15 minutes, and then you have the other 15-20 minutes, and you are like, let's talk. And we used to talk and really helped a lot. And to be on, like a person like me who felt like things are not under my control with SG, when you know that you have a medical plan, like, if this doesn't work, this is option B, C, D, E. If this doesn't work, we know where to go to, where to go through. So, yeah, that has been very validating for me. And it felt like things are under control. And that really helped to reduce my anxiety.
I'm curious because it sounds like you got way more support in your second pregnancy with HG. And it's almost as if, and I'm unclear, it sounds like you didn't even know you had HG when you're in India until after the fact. And so I'm curious because then it's like, as you're pursuing the second pregnancy, 15 to 30% reoccurrence rate of HG with like about 30% of women with HG in their first pregnancy experience it again. How did you overcome your experience of having HG again with your second pregnancy? And assuming you knew, and even maybe if you didn't, like just even knowing that's how your first pregnancy was, how did you overcome that fear?
Yeah, so when I got pregnant, I never knew that I could get SG again. No one told me that there was a chances of reoccurring again. So I was like, okay, now I'm pregnant. It's going to be a fun pregnancy. And so the thing is, when I went to the ER for the first time, I had my India file with me because there it is more physical documentation than electronic. And I was like, this is my data. This is how my pregnancy has been. So she was like, it says clearly you had HG. So I was like, yeah, I had it. It is written there. Then she was, it was a bit embarrassing, but as well as insightful. Then she was like, you have high chances of getting it again. And turns out like I was sitting like, why didn't someone tell me that I am prone to get it again?
I mean, would you have done anything differently if you had known?
Yes. So later, once I delivered, I found that in the US, there are clinics which work particularly with SG in the East Coast. And they said that if you don't have in your location, we can help you out by talking to other clinics so that you can get help. So basically, you can go and stay there for a couple of days and get the plan. So, and they be like with the, so I didn't know that. that such a thing also exists. And if I knew that I had chances of getting it again, when I met my OBGYN before getting pregnant, I would have told her that time that we need a plan. If I am not able to meet you, what should I do? Where should I go? So I didn't know. Again, I felt like, I have been betrayed, to be honest. That feeling was of betrayal. You didn't tell me it's going to happen again. If I knew it would have happened again, I would have, spoken to the healthcare system where to ask help from regarding this. So the thing I would have done different if I think about it now is that I would have spoken to the doctors openly that we need a plan. If this medication doesn't work, what are the other options of the medication? Because for me, in the beginning, with my second pregnancy, oral medication wasn't working at all. So you have to take the medication anal. They put the suppository in your inside, and that is how it's supposed to stop it. So that is also very painful. Someone touching you physically is you don't feel comfortable. You're like orally it's supposed to work. Why I have to go through this? So yeah, we I had to try all the methods to stop it because they were like, once you go back home, the IV drip is off. What to do next? If it happens at home, how I'm supposed to control it? So it's quite painful.
Yeah.
Yeah.
I mean, I think I hear of stories of some moms that say, like, I absolutely cannot do this again because of the roller coaster and toll that it takes on my body, on my mental health, just to even go through pregnancy a second
Yes.
time. So I
Yes.
can imagine how hard that is being thrown in the second time also and just knowing for the first time, oh wow, it's a high chance I was going to get this again and no one told me. No one even told me.
Yes. Yeah. And I have read quite a research papers and I have interacted with moms through the Facebook groups. I know moms who had to terminate their pregnancy. They are like, my body cannot just take it. It's very physically and mentally exhausting. I will fall if, they're like, so, there were moms who were like, if you have been through and if you have terminated your pregnancy because of AHD, there are a lot of moms out there.
Yeah. Well, and imagine not just the physical support, but you also needed to, you would probably have prepared more even for the mental health support
Yes.
that you needed during that second pregnancy, too.
Yes.
Yeah.
And I remember sitting with my therapist and we are talking about it. So the main theme comes out that you feel sad and lost and grief for what you wanted and you couldn't get it. And I still remember, she still mentions because in my therapy sessions, I keep telling, I wished I had a pregnancy which was, joyful, active. And, everyone that does baby showers, gender reveal parties, and everything. And with the South Asian community, we have this 11-day function and everything. I was like, I can't do anything.
Yeah, you've talked a lot about your being a representation for your community to even being speaking out about this because otherwise maybe people in your community don't even know that this is going on or that it's not just a normal pregnancy symptom. And you have your experience yourself as a therapist working with clients in the South Asian community. Why do you think in general it's just so difficult to talk about mental health in the South Asian community? And like, what do you think it would take to destigmatize receiving mental health support?
So, in the South Asian community overall, there is a lot of stigma regarding mental health. Mental health issue is equal to you are mad. And the thing is, the cultural perspective plays a role. So in South Asian community, it is like if you are suffering, if you are having an issue, if you're able to adjust and come out of it, you are strong. But if you have an issue and if you're not able to deal with it, you are not that strong. You are just overthinking. You are trying to create drama. You want that attention. You are trying to seek attention through all this. Opening up about what you are going through is also a big thing. Just expressing these heavy emotions is also dismissed very easily. Second is the family reputation. If someone comes to know that, this person is taking, for example, medication for depression and anxiety, then it will come like, oh, what? There's something wrong with your family. So that open conversation, that's to be silent and isolated, these talks are not done in general. And what I have realized that every time in the South Asian community, when there's talk about mental health issues, They don't give that importance at all. What is importance giving to the physical health? And they try to dismiss it, and they don't want to hear it, to be honest. And it is very sad reality, but I am glad it's making progress, to be honest. People are opening up about their struggles, and they are telling that, okay, this is what I'm going through, and this is how I'm, for example, this kind of village is what I want, this is kind of support system I want. So it is improving, but we need more stories. That conversation should not stop. And that is what I do on my page. Like I don't expect anything monetary to come out of it, clients, but I'm just putting out my story that you are not alone. And I think I'm just going to do that till my deathbed. To be honest. I am not going to stop talking about it. Yeah. So I think to stigmatize it is like we need more conversations. Third thing I want to tell is the language. Now, for example, when I say with my clients, they don't come and tell, oh, I'm having postpartum anxiety or depression. These clinical terms do not come up. It's like they would say, I'm having these spiraling thoughts. I'm not able to sleep. So I think we need a healthcare system which is culturally compassionate as well. Someone who understands where you're coming from. And I would love the healthcare system, like, just give 10, 15 minutes with every patient and talk about their culture. How is their family system? That makes a huge difference. Because where in some communities it would be okay, for example, if you're having any mental health issues during your pregnancy or postpartum, it is okay. Whereas when I see in the South Asian community, it's not okay. I have been there. It's like, don't tell openly you're going through, don't tell you're taking medication, don't tell you're on Zoloft. So they will think you're mad, you're not able to cope up. But I'm like, without this, I cannot cope up. And I tell my clients like therapy. So I had few clients when onboarding, they were like, what is the use of therapy? And how will it help? And I was like, I do not guarantee anything that you will achieve your ABC goal, but here we are talking about your experience, the things which you have suppressed for so long. Let's talk about it. And yes, then they're like, okay, can we talk about it? So we have to at times talk in the language in which they understand. That is very important to destigmatize what they're going through.
Did this whole experience actually inform your practice and shape this path for you?
So I did my master's in counseling psychology from India. So I graduated, I was practicing there, and but during my training, we did not have anything which is, particular about pregnancy and postpartum. So now you know that you're a therapist, and when I was having issues during my pregnancy and postpartum, I didn't know. I was like, okay, I'm a therapist. I should know how to deal with it, but I am not able to deal with it. I remember speaking to my therapist back in India that I'm struggling a lot to understand this transition of motherhood. He's like, no, 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 everything is fine. I was like, everything is not fine. I'm like, how can you say that? Then I was like, this is not working out. Then, when I searched, I came across PSI. I was in India. The support groups which were running that time, it is like, IST time, and, the time in the East Coast is totally different. But I was like, it's late in the night, but it is okay. Let's see what it is. And that is how I know, okay, you can specialize into pregnancy and postpartum. And when I moved here to the US, I signed up for the training, gave my exam, and got my PMH-C.
Wow.
Yes.
Congrats.
Thank you. So I was like, yes, before I didn't know something like this exists. But now when I know, there are so many organizations back in India where I talk that you need clinicians who are certified in perinatal mental health. That is very important because usually back in India, it is more about, they need to be trauma informed and, specialize in CBT, DBT, but no one specializes basically in pregnancy and postpartum. So I was like, we need more training, more clinicians, knowing that such a training exists.
Do you notice any differences between your South Asian clients that are here in the US versus the ones in India?
Yes, I do. So the thing is, in the US, you are not staying with your family, extended family. Back in India, there is a lot of family dynamics, society. So yeah, there you might have to take permission even to see like a particular doctor. Whereas here you have the liberty to see. So there is lot of differences, but like in back in India, you have lot of support system and that is financially affordable as well. Whereas here in the US, it's quite expensive to ask or for any support. There's a lot of money, and the moms who have migrated recently, they might feel like, why should I spend on such things? Already I'm adjusting to everything. If I spend money on this, I have to cut down on other things. So the isolation is also takes a toll. So I think both the countries has its pros and cons.
Yeah, it's kind of like feeling like mental health treatment is a luxury instead of a necessity. And the thing is, as moms, we know now on the other side that that mental health piece is a necessity. It is so important that you are well if you want your baby to be well.
Back in India, with my first pregnancy, I didn't have a thing called birth plan. When I came here, I came to know there's a birth plan you need to make. And then once I was into like the PSI training, so I told my doctor, I get my physical birth plan, I get my mental health birth plan. Let's do it. And I really advocate that when you focus so much on physical health, focus on your mental health, find the options, just note it down what kind of help you need.
I also really love hearing that the PSI reached you across the globe because it stands for Postpartum Support International, but it's like so big in the US. Sometimes we forget that it has international reach as well. So it's really cool to hear that your story and journey of finding it there, coming here, being integrated part of it into their training, and now you're on the PSI California board, which is amazing. Congratulations on that, by the way.
Thank you so much.
Thank you for sharing your story. And we always end all of our episodes by asking our guests to reflect back and, in the spirit of healing your inner tigress, really thinking about what present day you would go back and tell a past version of yourself in one of the hardest moments. Is there something you would go back and tell her?
Yes, I would sit with that past version of myself and say that it is okay. It is okay for not feeling so great. It is okay for what you expected, for the discomfort. I would give that space for these heavy emotions. Usually we would dismiss it, but all these emotions which are heavy, I welcome them. It's okay. You are a part of my life, and healing has not been linear. There are ups and downs. These thoughts come and go, but it is okay. I accept you with a lot of love and compassion.
Thank you, Rag, for those wise words. And I also think that maybe this will kick off you being the South Asian Kate Middleton of HG. That now we have a South Asian face for HG, and maybe there's another mom, not just another mom with HG, but specifically a South Asian mom who's like, I don't see anyone that looks like me going through this, and I
Yes.
hope that your story reaches them.
Yes.
And if it does, where can our listeners find more of you and your story?
So on my Instagram page, I have my sign up page or the email address where they can reach out and they can drop me a DM anytime. They are always welcome.
Yeah, we'll link Rog's handle in the show notes as well. I mean, we connected on social media,
Yes.
which has been so great the last few years. And I love
Yes.
seeing your story and you sharing more as we go along. Because
Yes.
I think when we first started, it was mental health related, like perinatal mental health related. But the HG stuff, you've really started to open up about
Yes.
sharing that, which I think is just so important for somebody to find a story that they can relate to. And part of it is seeing someone that looks like you, that represents your Asian background. And so, again, we really appreciate you today.
Thank you so much for having me. It really means a lot.
We also wanted to plug that if you're planning to attend the 2026 Postpartum Support International's annual conference this year in Los Angeles in June, Raag will be presenting on early pregnancy loss in the BIPOC population. Be sure to attend and get an opportunity to meet her. Also, a big thank you to Raag for leaving us an Apple Podcast review 2 years ago when we were just starting out. We love getting reviews, and if you listen on Apple Podcasts, please leave us a review as well. It helps bring more visibility to Healing the Tigress and help spread this resource to more people who need it.
We want to thank you deeply for tuning into this episode of Healing the Tigress. The more we share these stories, the more we can help our AAPI mothers and partners. If you enjoyed this episode and our mission, you can help us out in the following ways. Follow our show wherever you get your podcasts. Leave us a rating and/or a review, and share our podcast with a friend.
We also encourage you to follow us on Instagram at Healing the Tigress, where we hope to build a community of healing tigresses and give you updates on what's coming. And if you want more bonus episodes, please check out our show notes for how to subscribe to our exclusive content. Or you can also head over to our Buzzsprout page at healingthetigress.buzzsprout.com. We're not for profit. We are here to help our community, but any support you give us is so deeply appreciated. Above all, thank you from the bottom of our hearts for being here.
Healing the Tigress is produced and edited by Peggy and Jasmine.
Music for this show is remixed by Dr. Tony Huynh of Tony Mixes.
Our intro music is a cover of You and Me by Z Avi, played by our co-host Peggy.
Our outro music is a cover of Green Island Serenade, played by Jasmine's sister.
Cover art design is by Dr. Angela Chung.